Is hip pain ruining your golf game? Then this is the video for you. My name is Dave Harpin. I'm a physical therapist with P4S Golf, where we've helped over 15,000 golfers achieve longevity in their golf game. If your hip has kept you from playing the golf you want, just continue to watch this video. So today we're going to be talking about why your hip may be bothering you when you're playing golf. The hip is often less considered compared to other areas with golfers in terms of areas of pain that can affect their golf game. But as someone who works with golfers every single day, I can assure you that the hip is a fairly common issue that can affect not only your swing mechanics, but can also just affect your day-to-day life. So if that is you, continue watching this video. Now, when we look at the hip, there are a series of muscles around the hip. You have your glutes, your hip flexors, your quads that insert onto the hip. But one muscle that often gets neglected is this TFL muscle right on the side of your hip here. We call it the pocket muscle. Now, this pocket muscle is so important because golfers are often shifting weight from side to side as they play and rotating their hip. And when they do this, they're putting a lot of pressure through that TFL muscle. So if you're someone who feels like you have this hip pain gnawing right at the side of your hip, the TFL muscle could be a potential answer to some of your golfing issues. Now we are going to put a little diagram up so that you can see where that muscle is located. So when you watch this video, just take a look at that TFL muscle there. One of the reasons this muscle is so important is because in golf, you must be able to internally rotate your hips, which means be able to turn like this onto your trail hip and turn like this onto your lead hip. So if you're a person who struggles to really create hip turn in your swing, some tightness in this TFL muscle could be one of the reasons why that you're experiencing some of your hip discomfort. So as we go on here, I'm going to show you how to hit that muscle with this lacrosse ball. And this can be one of the ways to just free up that muscle and lower some of the pain there. So to find the TFL muscle, you're going to go onto the floor sitting just like this. And you'll notice right on your side, if you roll your foot in and out with your knees straight, you'll feel a bone on the side of your hip popping in and out. That bone is called your greater trochanter, right on your femur. If you place the ball there and then just roll directly upwards, you're going to find that pocket muscle called your TFL, or tensor fascia lata is the full name of it. So once you find that spot and you feel like you're right in there, right in that pocket muscle, I want you to roll onto your side and place your body weight on top of the ball. So that TFL muscle should be right on top of where the ball is. If you've never done this before, you're likely going to feel some discomfort in this muscle, especially if you're a golfer who rotates their hips a lot. This is typically one of the more tender areas we're going to find. You can just lay directly on the ball for about 30 seconds to 60 seconds. You can also take your leg and start a small rotation of the leg as you have that ball pinned underneath you. And if you do that, you'll probably feel that muscle moving between the ball and your body. Again, you can do this for about 30 to 60 seconds. You can do this on just the painful side, or you can hit the other side as well.
Let's take a quick second to talk about our golf performance assessment. This assessment takes only 5 minutes, and it'll tell you exactly where you need to improve in your golf game. It's 4 quick mobility tests that every golfer needs to pass in order to have a powerful, consistent swing and play pain-free golf. But less than 1% of the 12,000 golfers plus that we've tested pass all 4 of these tests. Not passing them leads to pain, swing faults, loss of distance and speed every single year. So click the link in the description and do our 5-minute assessment to see where you need to improve the most. And for a limited time, you can also get on a call with one of our experts free of charge to go over your results and what they mean for your golf game. Click the link below and try it out.
After you do this, you may want to find a little way to retest whether or not the pain has improved at all. One of the retests we commonly do is retesting your hip internal rotation range of motion while you're in a seated position. That may be a test you want to look up on some of our other videos, or you can take our home assessment that we'll put into the link below. If you want to take that home assessment, you can do that hip internal rotation test, roll out the TFL muscle, and then retest it and see if you've made any improvement there. That's typically a good indication that this TFL muscle might be one of the big problem muscles for you. Now, another muscle that obviously can have a big impact on your hip function is your glutes. There are actually 3 glute muscles in your posterior backside of your hip. There's the glute max, the glute med, and the glute min. Now, it's very difficult to get to the glute min muscle because it's very deep, but we can hit the glute med muscle by going off the top of your pelvis here. So the very top of your pelvis, if you just kind of palpate around up here, if you find that pelvic bone and then just roll slightly down from it so you're into your hip area, you're going to find your glute med up here. It's almost like right on your belt line. From there, you can put your weight onto that muscle. I like to cross my knee over my hip and then place my weight through that area. And bam, I'm right on that glute med muscle right there. I really find that crossing the foot on the knee helps expose that muscle a bit more. So from here, you can just roll out on top of that muscle. And bam, this might be one of the muscles that's really causing you some issues. So try it out, and then again, you can do that test, retest, and see if your hip rotation numbers have improved at all after doing the release. Finally, we can hit the glute max muscle and other deep hip rotators by just placing that ball anywhere where this big meaty part of your butt is. So if you find your pain is kind of lower down in your hip, this might be a good place to work. All you're going to do is place the ball on the ground, sit in a semi-reclined position with your knee bent, and then you're just going to roll right on top of the ball here. With this one, this deep hip rotator release, you do not have to be quite as specific with the ball location compared to the glute med and TFL because this is a much bigger muscle. But you can roll around and try to find any of those really tender spots. Some people are going to have a lot more tender spots than others. If you're currently dealing with hip pain, this is often an area that people will really be like, ooh, each spot feels really stiff and sore. So roll around. Once you find a good spot, you can take your knee and just roll it over that ball right there. And that should give you a nice sensation where it feels like the muscle is getting worked. So again, if you are a golfer who is dealing with hip pain that's affecting your swing or just affecting your everyday life, I would start here with these 3 basic ball releases. See if you can get any sort of relief from doing that. And if you can, I'd follow along with some strengthening exercises afterwards to get stronger throughout your hips. If you do feel like this is a problem that's affecting you, again, take a look at our link below where you can take that free assessment to test your hip rotation and to test the other parts of your body as well to make sure, all right, maybe my hip issue is more related to my low back, or maybe it's more related to a different area of my body. So I would strongly suggest taking that free home assessment and then utilizing that information to assess your progress as you move forward.